Hi, I am Deborah Engelhart Nash, and I think that one of the most important pieces of technology and one of the most important pieces of machinery you have in your practice is your telephone, because it is the portal in which patients reach out to you and you reach back. So I want to give you a few tips today on how you can maximize your new patient phone call and your telephone protocols. I'm going to give you a few tips that can get you started. First of all, I think it's important that anytime a patient is calling your office and they're starting to ask you questions and you want to get information from the patient regarding name, address, insurance data, you should always be asking permission. So when a patient calls your office and you want to start getting their records, want to compile their information to make an appointment, ask their permission first. Say something like, so that I can schedule this appointment for you, or so that I can start your records, or I can sure that we meet your expectations today. May I ask you a few questions? So for me, that's always number one. May I ask you a few questions happens before we launch into the what is your name, social security number, what is your medical history, do you have to be pre-medicated? So always ask permission before you start asking questions. I think secondly, most importantly, is for you to find out the nature of the patient's phone call. Why did they call you today? We have a tendency to, once again, we launch into a conversation about what our office standards are, what our office policies are. And really the most important thing we find out is, why did the patient call today? Now, if they're a patient of record and you're using a great system, their picture pops up and you know who they are, you can easily gather that data. But if I'm a new patient, then I think it's important to find out what inspired me to call today. And that is the question. I think that's an absolute key question. Tell me what inspired you to call today. Because think about this, the patient who calls you today wants to make a difference in their dental life, and you need to find out what that is and how you can serve them well. I think it's also important to realize that we have a tendency in our dental offices to tell the patient what we expect from them. We talk about the behavior we expect them to modify. We want them to bring in their appointment card, or arrive early enough to fill out the paperwork if they haven't done it online. We want them to bring their insurance information. We want them to bring all their medications. So we sort of give them rules and regulations of being a patient in the practice. We tell them what we expect from them. And I would like for you to think about, rather than telling your patients what you expect from them, letting them know what they can expect from you. So I want you to think about this. The telephone is a marketing tool to let your patients know what you are going to do for them, how you're going to help them, and how you are different from another dental office. So when your telephone protocols are different and they are exceptional from another standard call, your patients are going to realize that you're a different practice, and they're going to learn to expect greatness from you and be excited to make that appointment.